China is once again battling the outbreak of a deadly infectious virus. Which steps are officials taking to contain its spread? And on the economic front, the IMF is now offering a more optimistic prediction of China's GDP growth for 2020. What explains the suddenly sunnier outlook? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Qiuyuan, sitting in for Liu Xin. Now, with the trauma of the 2003 SARS epidemic still fresh in their minds, the Chinese are moving quickly to contain the latest outbreak of the coronavirus. As of 8 p.m. Thursday, 640 cases had been confirmed globally, with hundreds more suspected. Moreover, 17 deaths are linked to the virus, all in the city of Wuhan, where the epidemic reportedly originated. Yet, as China's National Health Commission confirmed the human-to-human and even communal transmission of the virus, public anxiety has spiked, especially on the eve of Chinese New Year, when hundreds of millions travel to visit families. So what steps are Chinese officials taking to halt its spread? Well, joining our discussion is from Washington, D.C., Dr. Eric Ding, an epidemiologist at the Harvard Chan School of Public Health, and from Nanjing, Dr. Wu Zhiwei of the Center for Public Health Research at Nanjing University. And also here in Beijing, Dr. Ke Chen from the Beijing Institute of Genomics at the Chinese Academy of Sciences. Welcome to you all. So, as we mentioned, as of 8 p.m. Thursday, health officials had already confirmed a total of 640 cases infection with the novel coronavirus. Globally, 17 deaths are reported, while the epidemic has spread to nearly every Chinese provinces. Some cases have also been confirmed in Japan, South Korea, and also Thailand, of individuals who had reportedly visited ground zero of the crisis in Wuhan. So let me start with Dr. Ke here in Beijing. The numbers are climbing very fast to our eyes, but from a medical perspective, how contagious and how lethal is this virus? Dr. Ke.
Hi. From the point of my view, I think it is controllable so far, and the central government and the local authority take a series of methods to take with this issue, and I think it will be controlled in the coming future.
And Dr. Ding from D.C., what's your prediction? I mean, what should we know about this virus? How long will the surge of cases continue?
Well, the number of counts in the past few days has more than doubled, and I think there's a lot of reporting that a lot of local authorities are not fully reporting the cases properly. So I think the counts will double or triple, but the actual infection may not, because as more people are confirmed to have this disease, the numbers will get bigger, so you don't have to get scared there. But I do think there is a significant undercount. So the numbers will get worse, but we will see how fast the virus is transmitted, especially with the new quarantine for these major cities.
And Dr. Wu, let me bring you in. On Tuesday, China's National Health Commission said that infection cases were mainly related to Wuhan, but concentration of cases there, including among the medical staff, showed that the risk was not just of human-to-human transmission, but of, quote, community transmission. And what exactly does community transmission mean? Talk to us more about it, and what are the potential risks there?
Well, actually, the community transmission is it's an issue basically involved in administrative localities. You have schools, and you have domestic residents, and also some community centers as well. The issue is that if the virus is spreading in the community, then that actually is a very serious issue. So I think it's very important that right now communities or cities outside of Wuhan, they need to keep strict surveillance and take appropriate measure to contain the virus spreading in their communities.
And Dr. Chen, so you are an expert on genomics. We know that this virus, the genetic sequences have been shared with the World Health Organization. Is there a risk today of a larger scale outbreak like SARS? How does this virus compare with SARS? That's the question on a lot of people's mind.
Yes, there is a similarity, and actually the number is 80% similar between the SARS virus and 2019 novel coronavirus, and the similarity is high, but it's not fact that the virus is also serious as SARS virus because they just sequence, not the virulence.
Dr. Ding, is that also your assessment?
Yeah, the viruses do share a lot of similarities, but we can't compare apples to apples yet because there was significant underreporting of the SARS virus many years ago, and so we cannot match the curves together to see is this virus more viral, infectious than the other. But this one, the numbers are jumping very fast, and we have some concerns, especially based on the latest report from London.
And in Wuhan, a city in central China with an estimated population of 11 million people, the authorities have now suspended all public transportation on Thursday morning, including buses, trains, airplanes, and ferries. And in fact, officials have basically quarantined the city by asking citizens not to leave the city unless there are special circumstances and warning outsiders about visiting the city. Additionally, people in public places are now required to wear surgical masks to prevent exposure to the virus. But Dr. Wu, how effective are such measures to contain its spread? What do you think?
I think that, it should be effective, and also I think it's a highly necessary step to take because Wuhan is the origin city of this epidemic, and apparently, all the cases outside of Wuhan, they have more or less some kind of connections with Wuhan. I think so. It's critical, to take a quarantine approach and prevent and exporting new cases into other cities.
And how long will the suspension last, considering that the Spring Festival holiday will last about 1 week and many millions will either have to leave or return to Wuhan for work? Dr. Chen, what do you think?
Yes, because it's a traditional Chinese holiday, more and more people on the way of traveling. So it's related to the delayed spreading. But it's also sometimes we can do something useful to stop the spreading because the traveling ban in Wuhan, which is a good way to stop the spreading. That's my point.
And as of now, the source of this coronavirus has not been found. The virus itself seems to be mutating. China's National Health Commission said experts are still in the process of, quote, constantly learning about this virus, even as it spreads across the country. Dr. Ding, do you think the epidemic is still controllable, as some has suggested earlier?
I think it is controllable, but at the same time, we have to realize, the testing and diagnosis of everyone who is infected is identified because this virus mimics many other pneumonia, flu very easily, and there's many other viruses going around. So it's tricky. For example, the case in the United States, in Washington State, that person came from Wuhan, but that person actually already came to the States before the quarantine was in place. So as you know, it's already gone to many other countries, and it all depends how viral this is. I think Wuhan right now is locked down, but I'm worried about all the people who may have been infected before the quarantine lockdown was down. So right now, we're in the critical wait-and-see mode for the next few weeks.
What about vaccines, Dr. Ding? Is it possible to develop a vaccine faster than the spread of this virus?
Well, vaccines take a lot of testing. Flu vaccine, for example, we do not have a universal flu vaccine yet. But it depends on how fast this virus mutates, of course. If there's many different varieties, it will take a lot of time. And again, the testing itself the Ebola virus testing, if you look in comparison, still took like 6 months to a year to complete. So I don't think we can rely on a vaccine in the next 2, 3, 4 weeks.
Oh, geez. Okay. According to Chinese medical experts, the coronavirus caused pneumonia as infectious during the incubation period, even without symptoms. And that means those infected with the virus could spread it to others without even knowing it. I mean, Dr. Wu, how do we prevent this kind of transmission from happening? They could be going under without detection because they're not showing any symptoms. They could be carriers, but they can't detect it. And that would be a problem.
Well, yeah, I think that's the hardest part of the intervention because if you do not have symptoms, if your body temperature is normal, then it's very hard to, to identify and take a prevention approach. So that's why actually the local Wuhan quarantine lockdown is very critical. The other thing is that we need to just pay tremendous attention on on people who already left Wuhan and migrate to other to other cities, and to see whether they have any early signs of fever and other symptoms.
Okay, and the Chinese public has really begun to panic about the virus spread, and most are snapping up surgical masks and even goggles. And here in Beijing, some 80 or 90% are walking around wearing masks. We are seeing that on the streets, and as most workers indoors. Is there any advice, Dr. Ding, is any advice or suggestions you can offer to soothe public anxiety?
Yeah, I think the #1 advice is stay home, because even if the city is in quarantine, if you go to schools, for example, are the ultimate laboratory for spreading viruses among children and poor hygiene. So I think staying home, instead of going to critical urban shopping malls and other areas where people congregate, is the best way to protect. It's the isolating yourself from exposure. Now, there may be some economic downturn temporarily, but that's offset in the greater scheme long term if there's a global pandemic or national epidemic.
Right, and the source of this virus, the source is still uncertain. Some experts link it to a seafood market there in Wuhan, while other researchers say it may be a wild animal, perhaps a snake, a mammal, not a bird. What's the difficulty in determining the source, Dr. Wu? And how important is it to identify the source? Is that one key to containing the virus spread?
Well, actually, I think it's very critical to identify the source of the infection, because for a number of reasons. One is that you could, basically take measures to prevent the further outbreak. The second is that by identifying the source of the infection, actually you could basically look at how the virus is transmitted. And so far we have no idea how the virus is transmitted, by what route, who are actually the susceptible populations. There are a number of public health issues in the virus transmission and the source of the virus.
And Dr. Ding, on Wednesday, the World Health Organization postponed until Thursday its emergency talks on whether the coronavirus outbreak in China constitutes a so-called public health emergency of international concern. If it becomes a global health emergency issue, what does that actually mean? Why is that significant? What would happen then?
Well, if WHO declares a worldwide emergency, a public health emergency, then they mobilize a lot of resources. They pull resources from many other areas, and that also compels each country's CDC of each respective country to mobilize their resources. But there's obviously, some people say WHO sometimes declares these emergencies too late. For example, Ebola was declared emergency much later than people would have liked. But the key thing is trust WHO and trust your country leaders, and do not, do not block them, and do not oppose them in terms of mandating public health, quarantine, and other restrictions, because in terms of global health crisis, this affects us all, even if you live in a distant corner of the globe where you don't think you might be infected. But in this day and age, with global travel, everybody is potentially exposed.
Yeah, and people here in China are united in this fight against this virus, showing their support for the medical personnel fighting this battle on the front line. And we wish them all the best. Thank you very much, Dr. Eric Ding from the Harvard Chan School of Public Health, Dr. Wu Zhiwei from Nanjing University, and Dr. Ke Chen from the Chinese Academy of Sciences. Thank you for joining us.